AsfalisMed, Asfalis Greek for safe and secure, founded by Travis Ballou and Joel Florek, two students at Michigan Technological University, is utilizing the power of quick response, or QR codes, to connect the latest information and technology systems in order to integrate the way our health information is shared. In 2008, there were over 123 million patient visits to emergency rooms in the U.S. alone. Of those, roughly 18 million arrived by ambulance. During these visits, nearly 100 million patients reported being on medications, and over 64 million reported being on multiple medications. But what happens when you have an accident and can no longer communicate to first responders and medical staff about your medications, let alone your allergies or medical conditions? What can you do when you're unconscious and medical staff is about to inject a drug that could potentially kill you? Unfortunately, nothing. The problem with communication in our healthcare system today is that our most common ways of providing information too often have the potential to fail in serious situations. When we can no longer verbally communicate our information, the hospital has no physical records on file, and their electronic health record system isn't connected to a national database, doctors and nurses are left to making potentially risky decisions with guesses and chance. The only thing you can do to protect yourself is by wearing medical ID jewelry or by carrying a medical ID card. However, both of these forms leave medical staff with minimal information and are so scarce that searching for these forms of IDs can lead to wasted efforts. The solution is AsfalisMed's QR codes, strategically placed on driver's license and school IDs to create a universal standard and a nationally integrated medical health records platform. By providing QR codes, medical personnel and first responders can simply scan the codes with virtually any smartphone or tablet and instantly connect to the patient's medical profile. This allows us to declutter our current system of sharing medical information with one simple tool: medical QR codes. The true value that our medical QR system can provide will only be obtainable once we reach a state and national scale. To get there, we are specifically targeting college campuses, since most students are required to carry IDs to access buildings, print documents, and purchase items throughout campus. It is the ideal group dynamic to begin targeting larger urban communities. Once we expand nationwide, we can begin to test and implement our medical records database to nearly 6,000 hospitals in the U.S. and over 800 million citizens in Europe. Quick response, because every second matters.